Morning, everyone. Welcome to episode 67 of ADHD Superpower. Today's topic is on ADHD and psychedelics such as LSD. ADHD and addiction is it linked? Research shows that teenagers with ADHD are more likely to abuse drugs than alcohol. Kids with ADHD may be drawn to substances that make them feel calm. Plus, their brains might be more sensitive to drugs, which can cause them to be addicted faster. Lion's mane. Lion's mane is a mushroom marked as delivering brain-boosting benefits. As with many proposed alternative treatment, it claims to treat many symptoms, such as Alzheimer, anxiety, depression, Parkinson's, heart disease, and multiple sclerosis, or MS. Given the vastly different causes of this condition, it's highly improbable that one intervention could provide universal benefit. Therefore, more research is still needed on humans to determine if lion's mane has a therapeutic effect. And that was from Tuchman, December 2023. So I'm going to go on and talk about what I found on LSD. I've never done it. I'm not going to do it. I've tried microdosing mushroom. Didn't do anything to me. Never tried LSD. Never tried psychedelics. So, I'm just giving out education for you guys. So, for anyone management symptom of ADHD, the added concern of drug abuse is especially serious. Not only does a powerful hallucination like LSD dramatically affect a person's psychological health, the drug interacts with only ADHD medication a person takes, putting him or her physical health at risk. LSD abuse is a complex issue. When LSD use occurs alongside ADHD, symptoms are more difficult to understand. A person with neurological issue like ADHD struggles to maintain normal functioning with attention and self-control. A person with ADHD, however, particularly untreated ADHD, may turn to LSD as a way to escape the stress of living with neurological symptoms or as a way to experience enhanced sensory perception, which I'll talk about that later. Actually, I'll talk about this now. This is from Joe Rogan's experience that I listened to. When you are doing LSD or any psychedelics, you need a guide. It's a spiritual guide. Apparently, the psychedelics are very spiritual, and it does enlighten you in some way that makes you make sense of your life. At least that's what Joe Rogan has said. But you need a guide. Don't just do it for fun and get high and get fucked up. Like, that's not the whole point, And I hope that I present some of the dangers of using LSD as well here. So, LSD does not provide relief for ADHD. There we go. And the drug actually makes ADHD symptom potentially worse. There you go. A person with ADHD is more likely to be impulsive and practice poor judgment in stressful situations. There you go. These symptoms make it more likely a person with ADHD will try LSD and become psychologically dependent on a drug. There you go. A person who uses LSD puts himself at risk in a number of ways. The drug's hallucinogenic properties produce visions and mood swings, intensify mental health disorder, including schizophrenia and bipolar disorder. Is so dangerous taking LSD psychedelics with schizophrenia. Like, I have friends who are schizophrenic and they never taken it, but the research I read is extremely dangerous. If you're listening to this, don't do it. Okay, so does ADHD cause LSD abuse? ADHD does not cause LSD abuse. Although someone with ADHD symptoms is more susceptible to LSD use because of our impulsiveness and attentiveness, as well as hyperactivity and the desire to try something new to get us excited. ADHD creates added pressure and stress in a person's life already, and stress is the primary reason for some people using LSD. People who have trouble managing ADHD symptoms experience social pressure such as bullying or extreme disappointment from others may use LSD to self-medicate. Self-medicating escape problems may exaggerate a person's psychological dependence on LSD. So, lastly, a person with both LSD addiction and ADHD benefit from specialized treatment. People with multiple conditions, also known as co-occurring disorder or compound disorder or poly disorder, need to be integrated treatment programs that treats both conditions at the same time, using either medication as well as psychotherapy. Traditional addiction treatment does not offer treatment for ADHD, so this approach leaves the person with only half the necessary treatment. On the other other hand, dual diagnosis treatment addresses a person's LSD addiction while offering strategies for managing ADHD symptoms. During a dual diagnosis treatment, patients learn about links between ADHD and LSD abuse, give them a better understanding of the reason they started using drugs in the first place. Patients also learn the coping skills of managing both conditions, making it easier to avoid temptation to use the drug and to deal with stress. Many patients find the strategies they learn in addiction treatment improve their overall quality of life, giving them a richer, fuller life that they have not previously lived. I'm not crying, it's the wind. Take care, guys. Thank you for listening.